The coronavirus testing increasing valley-wide. Along with that comes a rise in coronavirus cases. Joining us now live via Zoom, Dr. Christopher Romero with Valley Baptist Medical Center. You've checked in with us here over the past few weeks during this pandemic, Dr. Romero, and we thank you for that and welcome again.
Thank you for the opportunity.
So let's begin with the Texas reopening. And where do we stand at the state and local level with the COVID-19 cases?
So I think it's a mix of both good and bad news. Good news is that we have had such an expansion in the amount of testing that we've seen across the state and here locally as well. You know, well over a million Texans have been tested so far, which is fantastic. And we've doubled the amount of testing we've done here in the Rio Grande Valley compared to where we were at this point last month. Unfortunately, we still continue to see fatalities from COVID-19. Here in the Rio Grande Valley, across all four counties, we've had 53 fatalities. And, you know, we're a little over a week into this month. And this month alone, we've seen 6 people pass away from COVID-19 here in the Rio Grande Valley.
So what's the best way to look at the increase in cases? You just mentioned the deaths. So this is a post-Memorial Day holiday, easing of restrictions. Maybe look at it in terms of the infection rate. Any big changes that you guys are tracking right now?
So I think it's going to be a little bit difficult to interpret the infection rate because we have had such a large increase in testing. So it looks like we have a lot more cases occurring. That number of cases has gone up, but it's also gone up with the number of people that are being tested. We're just looking more diligently for those cases out there. The good news is that across the state, on average, the fatality has been coming down. One of the things we have to pay very close attention to are the number of patients that are requiring hospitalization. That's going to give us a good indication of how severe this underlying threat from COVID-19 is within our region.
Yeah. So Governor Abbott announced more cases of remdesivir will be sent to 3 Valley hospitals. Can you expand and tell us a little bit about the success you might be seeing in treating COVID patients with that drug, and also any other treatments that maybe are currently being used and tried?
Yeah, fortunately, we have had the opportunity to use this antiviral remdesivir at our facility, as of other hospitals across the region. You know, with COVID-19, it's still a lot of supportive care, making sure we're providing oxygen support. One of the things that we're doing a lot with patients with COVID-19 is proning them, actually having them lay on their belly while they receive additional oxygen, and that's been able to help them out. One of the things that we've been using more frequently also is convalescent plasma from the blood of patients who have already recovered from COVID-19 being used as a therapy to treat patients with it currently in the hospital. And that's being done under the nationwide study being conducted through the Mayo Clinic.
And explain to us, you just mentioned putting the patients on their stomach. Why that particular position?
Yeah, so the amount of lung volume is actually larger in the back. So if we lay on our stomach, the area that's aerated, that has oxygen and air going through it, is actually increased over people's backs when they're laying on their stomach. So that's been something that's been used for years in the intensive care unit setting, and we're definitely using it quite a bit for COVID-19 patients.
So with restrictions easing, why is it still recommended that, again, people, and maybe some of the test results will bear this out, but people wearing face coverings, practicing social distancing, why is that important that that continue?
You know, there's a lot of information out there, and sometimes it feels like it's conflicting. We're hearing we should do this, we may not need to do that. I think it's always good to get back to the basics. We still have people coming down with infections with COVID-19 in our community here in Texas. We still have people developing severe disease and passing away from the virus. So we know a few facts about this new viral infection. One, it's very contagious. It's easy for people to pick it up if they're exposed to it. Number two is that it's primarily transmitted through two modes. Those respiratory droplets, small itty bitty droplets of water that may contain virus particles that are emitted from our mouth whenever we cough or sneeze, but also they're emitted when we do things like talk or just even breathe normally. And when those droplets fall on items, they contaminate those items. And if we touch that contaminated surface, then touch our face or something that we're eating or drinking, we run the risk of getting infected. So there have been a number of studies looking at the distance that these kinds of droplets can travel. When people sneeze, it's been shown that droplets can travel up to 18 feet. When we're just talking or breathing normally, they can travel up to 3 feet. So that recommendation of staying 6 feet apart really does reduce that risk of contracting the virus if you're around somebody who's infected. And there were really good studies done in Singapore during the early phases of this, and this was supported by new data that was recently published in the New England Journal of Medicine, looking at the outbreak that happened in Washington State, that patients are likely transmitting this virus when they're pre-symptomatic, before they ever even have symptoms and know they're infected.
Dr. Christopher Romero with Valley Baptist Medical Center. Again, thank you so much for joining us today. Some great information that you're sharing with us today. And it doesn't look like this is going to be ending anytime soon. This is going to go on through the summer, and hopefully things get better. But we hope to have you back to give us an update on how things are going.
Thank you. Appreciate it.
Take care. Be safe.